apologies, folks. We're having one problem with the live stream. Bear with us for 1 minute. All right, sorry about that, folks. And we were getting started now with today's briefing. Thank you very much for coming and good morning. As always, we're joined by Acting Health Commissioner, Dr. Cheryl Bedigal. Today's briefing is being live streamed on the Health Department's YouTube channel and will be available for future viewings there. Today's briefing will run until 11 a.m. As usual, we will present remarks first in English, then in Spanish, then open it up to questions from the press. We ask that media outlets coordinate internally to ensure that only one representative asks questions and that we limit questions to 2 or fewer. Please keep your questions focused on the topic of the COVID pandemic today. With those instructions out of the way, Dr. Bedigal, would you please start us off?
Sure. Good morning, everyone, and welcome back. So we're going to start with an update to our numbers. First, since the last time we talked, 1,580 more Philadelphians have been diagnosed with COVID. As of yesterday, we're seeing an average of 280 new cases per day, which is slightly higher than last week, but still below our peak a few weeks ago. 4% of test results we're receiving are positive, which continues to be a good sign that we're catching most of the virus that's out there. In terms of vaccinations, at least 83.6% of adults have gotten at least 1 dose, and 68.8% of adults, more than 2/3, are fully vaccinated. That means that we could see 70% of adults in Philadelphia fully vaccinated on or about October 1st. Yesterday, we reported that 46,500 teens between 12 and 17 have received at least 1 dose of vaccine. So before we move on, there's one more number I wanted to tell you about today. As of today, the City of Philadelphia and our partners have administered 2 million doses of COVID vaccine. Although it will take another day or so for the dashboard to reflect that accomplishment. In the last 9 months, thousands of people, many in the health department, but also folks who work at hospitals, federally qualified health centers, pharmacies, the Black Doctors COVID-19 Consortium, FEMA, and more, have persevered and have gotten us to this point. Through snowstorms and heat waves and tornadoes, during the most difficult 18 months that any of us have worked through, we did something that no one thought was possible. 2 million vaccines in 9 months. I don't know that I'll ever be able to express enough gratitude to everyone who's contributed to this effort. I also don't know that we'll ever be able to fully thank those Philadelphians who have worn their mask, socially distanced, stayed home when they were sick, and most importantly, been vaccinated. This has been an awful time, but seeing this city come together and literally roll up their sleeves to save lives is something we all should be proud of. So next, I want to talk about schools and COVID. Today, we are posting new guidance on screening in schools and when schools should pause in-person learning due to COVID to our website. As a reminder, schools have a number of safety measures in place to prevent spread and to protect those too young to be vaccinated. First, everyone in a school building must be masked, except when they're eating or drinking. Schools must enable physical distancing where they can, provide opportunities for good hand hygiene, and provide a clean site. We strongly recommend that everyone who's eligible be fully vaccinated. And finally, all schools in Philadelphia have to follow our guidance on contact tracing, screening, and quarantine. We've changed our recommendations on screening testing, and we are now asking that schools follow the CDC's guidance to conduct weekly screening testing for unvaccinated students where possible. This is consistent with the CDC's recommendation that screening testing be offered to students who have not been fully vaccinated, where community transmission is at moderate, substantial, or high levels, such as those in Philadelphia right now. Screening testing should also be offered to all teachers and staff who have not been fully vaccinated, no matter how much community transmission there is. We are also now including test to stay as an option for schools. This means that schools could allow close contacts of someone who tests positive in school to avoid the need for quarantine if, and this is a big if, the school is able to offer frequent rapid testing and the child tests negative every other day for a week. Next, our recommendations for when schools should pause in-person learning have also changed somewhat. First and most importantly, anyone who has COVID symptoms or doesn't feel well should stay home and get tested. When one or two people in a school test positive, their close contacts should quarantine for up to 10 days if they're unvaccinated. If they're vaccinated, they don't need to quarantine, but they should get tested 3 to 5 days after that exposure, so long as they don't have any symptoms. And they should make sure to mask in public. And I'll say that everything I'm saying here in terms of this protocol is on the website. If 3 people in a class test positive, that class should pause in-person learning for 10 days. If those 3 positive cases are in different grades or classrooms, the school should treat them like individual cases and just quarantine their close contacts. In the case where 6 or more people test positive in a grade, the school should call the health department immediately and discuss needing to pause in-person learning for the entire grade. And if 3 or more grades are paused, or more than 3% of the entire school community tests positive, the school should call the health department immediately and discuss needing to pause in-person learning for the entire school. This new guidance is less strict than our guidance before because we've seen that our other safety measures have been successful in containing spread, and because we're watching and learning from containment efforts in other places. We believe that it's possible to prevent wider spread of COVID in schools and keep kids in school. This does not mean that there won't be COVID in our schools. Community transmission is high enough that some students, staff, and faculty will be exposed at home or outside of the school and could bring it in. But with daily symptom screening, 100% masking, contact tracing, and vaccinations, we can stop that person from spreading COVID to others while in school. As with all of our guidance, we'll continue to monitor the situation in our schools and may change this guidance again if needed. Separately from schools, I wanted to point out as a reminder that all healthcare workers in Philadelphia are required to be vaccinated by October 15th. That means if you get your first dose of Pfizer by this Friday, you can still get your second dose before that deadline. You can also get the single dose Johnson & Johnson vaccine and make that deadline. Time is running out, so find the closest vaccine site today by visiting phila.gov/vaccine. To wrap up, if you would like more information, please visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. Thank you. And now Zelly will present these remarks in Spanish.
Buenos días y bienvenidos de nuevo. Comenzamos esta mañana con una actualización de nuestros números. Primero, desde la última vez que hablamos, 1,580 habitantes más de Filadelfia han sido diagnosticados con COVID. Hasta ayer, estamos viendo un promedio de 280 nuevos casos por día, que es ligeramente más alto que la semana pasada, pero aún por debajo de nuestro pico de hace unas semanas. El 4% de los resultados de las pruebas que estamos recibiendo son positivos, lo que sigue siendo una buena señal de que estamos contagiando la mayor parte del virus que existe. En términos de vacunas, al menos de 83.6 de los adultos han recibido al menos una dosis. Y ahora el 68.8 de los adultos, más de 2/3, están completamente vacunados. Esto significa que podríamos ver al 70% de los adultos en Filadelfia completamente vacunados alrededor del 1 de octubre. Ayer informamos que 46.500.000 personas adolescentes entre 12 y 17 años han recibido al menos una dosis. Antes de continuar, hay un número más del que quería hablarles. A partir de hoy, la ciudad de Filadelfia y nuestros socios han administrado más de 2 millones de dosis de la vacuna COVID. En los últimos 9 meses, miles de personas, muchas en el Departamento de Salud, pero también personas que trabajan en hospitales, centros de salud